Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. So you know what's interesting about today's guest? Most surgeons focus on the procedure, but what if the real difference in patient outcomes starts long before anyone enters the operating room? Dr. Scott Miller of Miller Cosmetic Surgery isn't like most surgeons, as he believes great medicine is built around the entire patient journey, from the first consultation to recovery, all designed to make the experience smoother, safer, and centered around what the patient actually wants. So if you're like me, you want to stay tuned to hear what he has to say, because I want to hear his approach and how he goes about that. But real quick, a message from our sponsor, Growth Solutions, where we believe every healthcare professional deserves exceptional growth partners to match their ambition and reach their potential. Growth Solutions is not an agency or vendor. We're a growth partner, and we take kind of a diagnostic approach to your business where we analyze where time, money, leads, opportunities, anything like that might be leaking. So we eliminate stressors in the business, such as new patient or client acquisition, marketing and growth strategies, reducing operational chaos with certain SOPs and frameworks. And then we help you understand AI and AI agents, because those robots are coming for our business, whether we want it or not. So if you've ever thought this: I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. So feel free to drop in a DM to me at any point in time to see if you want a complimentary consult from a growth perspective. But you're here for a reason. That's to hear from our amazing guest today, and that's Dr. Miller. Welcome to the Prime Health Podcast, Dr. Miller, and please do tell us what you do and a little bit more about yourself.
Great. So I'm a board-certified plastic surgeon in La Jolla, California, it's what I was born to do. Feel really fortunate to sort of have somehow, and I don't know how, because, you know, we all with our kids and people we mentor, and how do you find your perfect fit? But somehow I happened into my perfect fit, kind of a combination of growing up as an athlete, loving oil painting and art, and just the pursuit of sort of beauty and pursuit in general and flow states. And it all came together in this field. You know, a lot of medicine is extremely algorithmic, where, you know, step 1, step 2, step 3, and plastic surgery, I think, is unique among the medical fields. There's aspects of each medical field, obviously at the highest level and at the far reaches of research, they get very creative. But, you know, at its core, on a day-to-day basis, many of them are very algorithmic. And plastic surgery is a very creative specialty where we're basically customizing a plan for each patient for their unique psychological, physiological, physical, and emotional needs. And that's just incredibly rewarding. So while I find I'm in a position where I see colleagues getting frustrated, burned out, or bored, I'm exactly the opposite. I've never been more enthusiastic, never been had more fun. And, you know, as a friend of mine in Dallas likes to say, it's prime time, baby. You know, we're really having fun. We feel like we've never been better at what we do. And so, you know, just incredibly fortunate to have found that sweet spot. I wish that for, you know, my kids and my colleagues and the people that I advise, because it's such a great place to be in. It's a little dangerous from a personal level, because you have so much fun at work that you have to make sure and keep things balanced and enjoy that as well. But it's better than the alternative.
Yeah, I will tell you, I've never heard anybody talk about flow state with medicine or surgery, and I think that's fantastic. I would want to play on a team with somebody that's always in a flow state. Therefore, I would think I would want my physician/surgeon to be in flow state in his profession. So that I love how you explain that. That's fantastic.
Well, I saw an article. It was funny. When I was in medical school, I saw an article by Mihai Csikszentmihalyi, which I couldn't pronounce it at that time, but I saw an article where it's a very short little outtake article I think it was in like the AMA News, which is very antiquated. It was like a little newsletter that used to come in actual paper form, and he actually talked about, that's when he first started writing it. I mean, we're talking back in like 1989 now, 90, and he was a professor at Chicago. I think he subsequently went to Claremont McKenna, and he talked about how artists, surgeons, and athletes kind of all had this similar state, that kind of working in the garage and didn't realize you'd been in there 5 hours because you were so involved and engrossed in your activity. And for me, that really hit home because as a college tennis player who did oil painting, who was interested in medicine, I thought, yeah, that's exactly it. And that actually was very helpful when I went to interview for residencies because it made it easier to explain why I wanted to do what I wanted to do. And I experience that every time I'm in the OR to this day.
Yeah, that's again, it's interesting. So who's the physician's name that wrote the article?
Yeah, so he's a researcher. His name's it's a Czechoslovakian name, but it's pronounced Mihai Csikszentmihalyi. And he was at University of Chicago at the time. Subsequently went to Claremont McKenna. I think his book was called Creativity, and that was the landmark book where he described flow. And like I said, this is interesting because this was back in the late 80s, early 90s. And I think in the last 5-6 years, somehow the world finally discovered his work. But these are things he'd been working on for years and years. And I think it really hits home when you kind of realize that. And I still experience that when which is rarely, but go out and hit a tennis ball or something like that. There's just that state of satisfaction and intrinsically being in the moment. It's funny, when I was a kid and playing tennis, and the book Inner Game of Tennis by Tim Galloway was very, very popular. And I can't say I fully dove into that at the time, but I think that's where he was kind of going with it as well, is just trying to lose yourself. My son played college tennis, and I asked my son once when he was in a junior tournament, and I noticed he was playing particularly well, and he was smiling when he was on the court. And I said, "Hey, Eric, I never seen you smile that much on the court." He goes, "I was just laughing because I couldn't miss." and he was just in that state, and so they call it the zone, flow, whatever you want to call it, where he was just positive feedback. The better he hit, the better he felt, the more he kind of stayed in the moment. So yeah, I think that's what surgery is all about. Surgery is a very complex state of maneuvers and decisions, and you really have to be in the moment because you can't, you don't get a, it's funny. I read a lot of business stuff. And when you read this business stuff, it talks about iterate, and fail forward. Well, that doesn't work in surgery.
No.
So I read that and I'm like, well, I don't know about that for us. So, we have to, for us, it's very much like a sporting event. It's game day, it's game time. You have to be ready. You have to think about it the night before and be there in the moment. And, if you have a sniffle or a sore, this or that, you got to put that aside and get to work. And so to me, there's a lot of event game day mentality that goes into surgery that has that commonality with sports. And then of course the creativity of art is brought in. So plastic surgery for me was a perfect fit, and I get to exercise it on the daily basis on behalf of and in the service to patients who are seeking ways to feel better about their presentation to the world.
Yeah. So you going into medical school, did you know right away, or because you were an athlete, were you thinking orthopedic surgery? Did you know right away because of that kind of art mix as well that you were thinking plastics or cosmetic surgery?
Yeah, I would say I had a bit of an inclination. I spent the summer before medical school teaching tennis at John Gardner's Tennis Ranch in Scottsdale. Okay. And so the thing is, in Scottsdale, in the summer, by 10 a.m., it was too hot to do. Nobody wanted to play. So we taught lessons from 6 to 10, and then we were pretty much done. So I opened the phone book, flipped through, and I found doctors of different specialties, and I asked them if I could come, shadow them and hang out with them and watch what they do and see what they do. So trying to get some idea of what I might want to do, including orthopedics, dermatology, plastic surgery, rheumatology, different fields. But, I did 2 or 3. And of course, coming from sports, you always think orthopedics a little bit, right? Having said that, most of my life at that point, my later youth and early adulthood had been spent really in the world of sports in a pretty big way, playing Division I college tennis and stuff. And I'd spent a lot of time in the trainer's room and everything. And I almost felt like, in a way, that seemed less evolutionary for me, a little bit boring. I really wanted to go do something sort of different and that was my own. So that kind of pushed me away from the sports a little bit and the sports medicine. And then I ended up working with a plastic surgeon who's now retired in Phoenix. And once I hit his office and started following him around, Jack Friedland, I really got lucky. I literally flipped the phone book and I ended up with the president of the American Society of Aesthetic Plastic Surgery and, a guy who was very charismatic, friendly, wonderful guy. And I followed him around for the rest of the summer. Every time, as soon as I'd finish on the tennis courts, I'd jump in the shower and run over there and watched him in the OR, watched him in the clinic. And just, that was it for me. I wanted to be that guy.
Yeah. Well, that's good that you had a great mentor to start with, even though, and there's no better way to do that, to get your feet wet, by following great people that are in practice and learn from them at the start.
Right. Having said that, and just to kind of, for any of the medical students out there or people early in their evolution, I definitely tried really hard to keep an open mind going into medical school. I think that's really important. I think you have to become a good doctor before you can be a good specialist of any type. And so, as I dove into every topic, I think if you get too mindset too early that this is what I want to do, then it's really easy to dismiss the other topics and fields that seem different but are really adjacent and really overlap and important. And this from your work, that you overlap with your peers of different specialties and different particulars. And first of all, it helps you serve patients. And second of all, you sound like an intelligent human being when you're talking to the gynecologist or the rheumatologist or the cardiologist. Right. And so, having that knowledge helps you serve your patients better and helps you interact with your peers better. So I think that's super important. And as I went on my rotations, I tried to keep an open mind. I loved pediatric surgery. That was my thing, is I loved everything. So I loved pediatric surgery. I loved vascular surgery. I loved gynecology. But I was really, to be honest, I loved serving and dealing with the women and the personalities and stuff. I won't say it was the particulars of gynecology that was so fascinating, although delivering babies was fun. So, at the end of the day, you look and you say, okay, what's the best non-decision decision? If you go into plastic surgery, you can do pediatrics, so you can operate on kids. You can do men and women. You can do young and old people. You can do microvascular surgery if you want. You can operate on everything from the top of the head to the toe to the finger. So to some extent, going into plastic surgery at first is kind of a non-decision decision, because you didn't, even though you're committing to a specialty, you're not committing to a gender or a body part in any way, right? Which is really unusual. And then, or a physiologic system. And then as I went through more and more, I kind of came back to my roots, which I really love beauty and proportion. And look, that's just as important in reconstructive surgery as it is in cosmetic plastic surgery. People who want to look better want everything to work, and people who want to be reconstructed want to look as normal and natural and pretty as possible. Right. So it's a false separation to some extent, but really focusing on the proportion and the beauty and the shape and form was really my forte.
Yeah, do you mind going in a little bit into the differences as you speak to it, Dr. Miller, from the reconstructive to plastic versus cosmetics? Is there a way to break?
Sure.
What's your thought on breaking those three?
No, I think it's super important. In fact, in my book, which I know we'll get to, I actually have a little box outlet to delineate, just so we get the language right, because it's so important, and it's so confusing for the public to really hone in on what people are talking about. And wait a minute, I'm so confused. In fact, we did a survey, just as an aside, in our waiting room. Me and I'm a part of this group called the Cannell Society in honor of Bruce Cannell, who was one of our mentors. And we did a little survey among about 20 offices where for a month we gave every patient who came in this little 5-question survey. And they were like, basically, one of the questions was, what does this mean? And what does board certified mean? Which board are you looking for? What does this acronym mean? What do these initials mean? And what we found out is basically most people knew nothing, and the people either knew they knew nothing or thought they knew something but knew nothing. And so it's really confusing world for patients out there. But basically, the field of plastic surgery it means from Greek plastikos, to mold or to change, and that involves restoring form and function to what either nature or misfortune has taken away. So congenital problems or traumatic problems, and congenital problems obviously can veer into aesthetics, right? Who's to say when prominent ears is a deformity or when it's just an aesthetic, unfortunate occurrence, right?
Okay.
What about a deviated nose? Now, obviously, when you can't breathe right, you can't breathe right. But I think everybody has a level at which they would call a deformed nose just not a great nose. And then there's a level at which you'd say, hey, that's a deformity. They should get that covered, right? A cleft lip, if a patient has a cleft lip, but it's only partial and they can swallow and they can purse their lips, is that just a cosmetic deformity? Most people wouldn't think so, right? So the line is really blurred, but basically there's two ways to look at it. One is, form versus function. And I don't think that holds up because, as I mentioned, people want things to work and they want things to look good. The other one, unfortunately, is just a ramification of our healthcare funding system, which is, is it covered by insurance or is it not covered by insurance, right? So cosmetic surgery appropriately done is a subsection of plastic surgery. It's cosmetic plastic surgery, and there's reconstructive plastic surgery and cosmetic plastic surgery. And cosmetic plastic surgery is more interested in taking things that would fall within the acceptably normal realm and making them look optimal or enhanced for that patient to give that patient more self-esteem and self-confidence. And then reconstructive plastic surgery is more the realm where things aren't quite working right, whether that's an obvious case, as in the case of a cleft lip or palate type of thing, or a Poland syndrome where you're missing your pectoralis muscle and you can't function right with your arm or do certain exercises, and you have a deformity where there's a gap, or there's a huge range. Plastic surgeons who do hand surgery for duplicitous contracture where the hand is contracted up, etc. So it's basically they all fall into the realm of plastic surgery.
Okay.
When plastic surgery is the only board certified by the American Board of Plastic Surgery or American Board of Medical Specialties to do cosmetic surgery. There are other sort of, as you know, you people can make and put an ink behind anything incorporated. Right. And there's the American Board of XYZ Inc. It doesn't make it an officiating body, but the American Board of Medical Specialties is certified by the AMA to certify different boards, and the American Board of Plastic Surgery is the one that cosmetic falls under, if that makes sense. Yeah. So I'm not saying that there's not people out there who are competent to do things that they do all the time. I tell people one of the biggest things you look for is somebody who does something over and over. So I don't care what somebody's certification is. If they do it once a year, I wouldn't go to them. But if you're looking for people who probably have the most foundational training, then that's going to be a plastic surgeon who's then zoomed in on a particular area and done it over and over and over. I think about it like, again, tennis was a formative part of my youth and maturity. And basically in tennis, I think there's people who play in adult tournaments and they're really a 4.5, but they play down in a 4.0 league. And when I was a kid, you might play down from, play down a level if you wanted to do really well, or you might play up a little level if you wanted to face a particular challenge. And so I always think as a patient, you want a doctor who's playing down. You want a doctor who's overtrained, overexperienced, and then doing a procedure that's not at the very peak of their skill set, right? And that's where flow, we come back to flow because flow is that state where you're not at your peak where your flow is disrupted because it's too much for you. You're also not below a level of interest or challenge where it's too boring. You're just right at that sweet spot. That's when you experience flow. And I think you want a surgeon who's there at that point where they're interested, they're fascinated, they're passionate, and yet, they're not, you don't have somebody trained to play mini golf and then they're suddenly playing Augusta. That's not a good idea either.
No, great point for sure. Putt, I can win at Augusta. Hopefully I can keep it in the greens.
Exactly. So if I have a paid from a surgeon standpoint in private practice, who's, I get paid, and more importantly, I achieve my personal satisfaction and peace of mind from hitting home runs, maybe the occasional triple. I can't, singles and doubles are very disruptive to my life, and striking out is unacceptable.
Yeah.
So to me, I want to stay in that zone of not only competence, but excellence.
Yeah.
And that, I do that by having sort of overtrained and then step back. So that's where I think that, being a board certified plastic surgeon, then zooming in on aesthetics, spending an extra year with a legend in that extra training, then going on and practicing for over 25 years, that's what I'm saying. That's why my friend in Dallas says, prime time, you're in your sweet spot because you worked really hard to be at that place where you can really serve patients best and help them to achieve their goals. And that's what it's all about. I mean, I think it's so many people in our industry get confused about who's the hero of the journey and who's Yoda. We're Yoda. We're here to help. And it's not our journey. And I think that is something that gets lost in the plastic surgery milieu sometimes. And I've even seen, well-known and well thought of surgeons from the podium, at meetings dismiss the idea that what if a patient wants this and what if a patient wants that? And, I'm here to mold my sculpture and make my art, and that's of no concern. Well, that is of absolute concern. Like, they have a messed up set of priorities, and they're forgetting who's the hero here,
Yeah. No, very good point. When you're talking about kind of hearing from others, learning from others, what it may be, I would assume in your profession of plastic surgery that you have a philosophy of how you practice that's grown over time. So how is your philosophy different than some of the other providers?
I mean, I think that you figure out what works and doesn't work, and what works really well and what works okay. And also, as I kind of go into in Authentic Beauty, is paying attention to the risk reward. There's things that are high probability and high ramification. And if those things are bad, we really got to stay completely away from those. There's things that are high probability and low ramification, not a huge concern, like let's say a cough after surgery or something like that, right? But then there's things that are really high ramification and low probability. We should stay away from those. So we kind of go through that. I want to do little things that have big effects. And I'm okay doing little things with little effects or big things with big effects. What you really want to avoid is big surgeries, big incursions into people's life and lifestyle, anatomy, etc., that don't really do all that much. There's no point to that.
Yeah.
Or things that have the potential for really big complications. I saw a patient today, and she could have a belt lipectomy, which is where you go 360 degrees around, but that's a 25 to 50% chance of some degree of low to medium to high complication. Now, do people really explain that when they suggest that procedure? I think not. So I think that, if you really talk that out for her and her life and lifestyle and needs and dependence and her kids and things she has to, then you say, okay, look, we have this other operation that's going to accomplish 85+% of what you want. And at that point, we can sort of guarantee that, within 3-4 weeks, you're back to your daily routine. You can be taking the kids to school and doing that sort of thing. That's a good example of a situation where, that matters. And it particularly matters. You got to put yourself in their spot and feel their needs and wants and make your suggestions from that vantage point. I mean, you look at things like, I jokingly say to patients, like, I could put a tail on you if you want, but that doesn't mean it's a good idea. So there's a difference between what we can do as plastic surgeons and what we should do.
Yeah. Yeah. You're bringing up a great point when you are educating your patient, because I can only imagine trust is important in healthcare in general, but trust in my body, how it looks, how I want it to look, how I want it changed, and the emotional side of that. How do you try and match that that emotional desire for change in patients, but still having medical having the right process to go through and having the right philosophy so that they get the outcome that they desire?
Yeah, I mean, I think I break it down. It sounds a little, it's kind of either catchy or cliche, but, I kind of think about visualizing, analyzing, customizing, actualizing to realize. So, I visualize what results are possible, We analyze the patient's existing anatomy and situation, and their home situation, their recovery potential, but also their anatomy and their wants, right? Mm-hmm. And then we customize a plan for them. And that's the part where you have to listen. You have to take in the information. I saw an interesting thing recently. It said the first word in every conversation should be a breath, which means pause and listen and take that in. And so then after we've customized that plan, then we meticulously actualize the surgery so that we can realize the result. But the key part of that is not just the surgery, which is what everybody thinks about, but the part that comes before that, where you listen, discuss, review, decide together for the patient, and you decide on a series of maneuvers. Now, I can't tell you, we always get people come in, they go, I want a deep plane facelift, right? But there's no the deep plane facelift. As I just gave a talk in Orange County about this, there's no the deep plane facelift. There's a deep plane that you use optimally to achieve that patient's desired results. Okay? And so it's not a step 1, 2, 3, this is how you do it, peel twice, stick in the microwave, right? You gotta look at the patient and assess them and say, what are their needs? Where are they deficient? What's their anatomy? How are they going to age? Look at some pictures when they were young. Maybe look at some pictures of their parents and see how they're going to age and make the best decisions for those patients in this situation. Take into account if they're from out of town, when do they need to leave? How long can they stay here in town? That all that matters because, I think patients are more problem averse than surgeons in many cases. And even when surgeons will tell a patient, oh, this could happen, because the patient wants a surgery, they can let that go right through them.
Yeah.
So you need to you don't want to think for a patient, but you do want to think with a patient. You can't just list out these things and say, okay, they said they're good to go and go. You have to say, does this really work for you? Because this is going to involve, for instance, if you did a tummy tuck with a bunch of liposuction, well, they're more likely to have fluid afterwards. So, and then they're more likely to need a drain for longer. Does that work for you? What's your, or you can get, lose 10% or 5 or 10% maybe of the result that you're going to get from doing the liposuction with the tummy tuck, but then you're scot-free and you're 2 weeks out and you can be healed and back to your activity. Or no, maybe that is worth it to you. I'm not making a judgment on that. I'm just saying each person needs to be aware of and know that. And you need to work through this. As a surgeon, you need to work through it with your patient. As a patient, you need to work through it with your surgeon. So we have a thing in the book where we talk about it's a decision. One of the things we tried to do is give a lot of tools and tips and tricks because when you write a book, the worst thing you want to do is write something useless. And it'd be really embarrassing if people you knew looked at it and said, oh, that's useless. So, I particularly put in a lot of tools and checklists and forms and decision tools. One of the things we have is the decision aid. The A stands for aggravation factor. The I stands for improvement potential, which you work out in discussion with your surgeon. And the D is for the downside considerations. So you say, and we have a scale and we have some questions that help people decide on where they fall in that scale, right? Mm-hmm. But it helps them give a ranking to what's the aggravation factor of this feature they don't like, what's the improvement potential, what's the downside consideration. You give them a score 1 through 5, but there's no 3. 3 is illegal because 3 is a cop-out, right? Okay. So 1 through, it makes you make a call, right? It's either a 2 or a 4 at that point, right? Yep. In the middle. So, and then you pop them into a formula, you get a score. And again, the numerical part is more facetious, right? The value of it is in going through that process. But you get a score, and actually, if it's 3 or higher, you probably should have surgery. And if it's 2 or less, you probably shouldn't, because the aggravation it's A plus D minus A plus I minus D divided by 2, and it's a funky score. But the bottom line is it works out where it works out almost exactly. It's always right. Is 3's kind of think about it, 4 and 5 do it, 2 or less you shouldn't be doing it because the aggravation factor and the improvement potential isn't enough to compensate for the downside consideration in your life.
Yeah.
And so,
And that patient probably doesn't know what the downside potentials are. You've got to coach them to that point because they're coming in so full of emotions and how they want things changed. You've got to help
100%.
them past that.
Exactly. For example, just to kind of cheat here and look at my own book.
So before you do that, so just so I can let everybody know, the book,
Yeah.
your book is titled "Authentic Beauty: Defining
Yeah.
a New Standard of Care and Results in Plastic Surgery."
Exactly. And so looking at where we have is, so for the improvement, you were asking about the improvement potential or the downside consideration.
It would be both.
Yeah.
Downside. Most people are coming in not thinking that there is a downside. They don't
Yeah.
see a downside. I want to change, and you've got to help them to understand there is a potential for a downside.
Exactly. So under downside consideration, a 1 would be I'm healthy, can afford it without stress or life burden, and can make the time. Flipping to the far side, a 5 would be not advisable due to health profile, current financial commitments, or time. And then there's some in the middle. And then we have some questions that help them to figure out where they are in that. So, for example, is it medically safe relative to other actions that you do in your life? Right? Because that might be different. Medically safe is different for somebody who likes to jump out of helicopters than somebody who likes to, go for walks at the zoo.
Yeah.
Do I have time or do I want to make time? Would it negatively impact my life or lifestyle? So those are things you would think about in order to help you score that downside consideration.
Okay.
So just as an example, you're absolutely right. It's again, there was a book by the widow of Jack Welch, Susie Welch, and she wrote a book called 10-10-10, where it was like 10 weeks, 10 months, 10 years. And any decision you had, I came across this when I was helping my son decide where to go to college. Okay. And so, any decision you had, you would kind of say, how am I going to feel if I decide decision A? How am I going to feel about that in 10 weeks? How am I going to feel about that in 10 months? How am I going to feel about that in 10 years? Right? And then, or what about option B if I decide no, and so again, the value is in the process of going through that thought process. And sometimes the answer kind of comes to you rather clearly. No, this is actually really something I want to do. It also makes you realize that you don't care about 10 weeks as much as you care about 10 months and 10 years. Right. So it's a perspective and priority setting activity too. So I found that really helpful. And then that kind of made me want to create something for our patients to help them work through, because I always saw them kind of mentally struggling and working through these kind of issues. And this seemed to really do wonders for them to kind of zoom in on, understand themselves better. And again, it's about them and themselves, but we can help them get there through some of these tools and charts and checklists and things like that.
Yeah. So the book, Authentic Beauty, was it written in your perspective for other physicians or for patients or a combination of both?
So it was primarily written towards, let's say, a sophisticated patient, right? Mm-hmm. So the patient who really wants to know more, to understand. It was written after 25 years of answering questions and seeing lights go on in patients as we discussed things and getting feedback for what information was helpful for them and what information wasn't. And I felt like there was knowledge that needed to be had that wasn't had, to make decisions that needed to be made so they can make them better. And it wasn't really out there in that way. In a way, there's some really simplistic books. You can get Plastic Surgery for Dummies, but that's kind of at a really base level. And then there's a bunch of medical textbooks that are written for doctors or for researchers, but there wasn't something in the middle and I think there's increasingly more and more patients who are fairly sophisticated about this stuff. They're doing their reading and they're doing their research, and they want to go next level. They want to understand as if their cousin, brother, friend, or neighbor was a really great plastic surgeon who could give them advice. Mm-hmm. I think that it serves a great function for patients, giving them a roadmap, a trusted roadmap to how to get to where they want to go. I also think it presents a practice model that patients can look for in the practices they see, but also a practice model that young plastic surgeons or people striving to be better, do better, provide better can use and follow to help serve their patients better. And then lastly, it tries to, explain a lot of facts, debunk a lot of myths, and go into some of the more procedural details and understand the processes better. So it's really broken into 3 parts that way. And so the practice paradigm part in the middle, I think, does present. I've had several doctors, both of plastic surgeons and other specialties, who found the practice model part, that presents a paradigm of practice, like our passion for performance, the four being quality, integrity, safety, and service, and how we incorporate those in our day-to-day service to patients. And I think that in this day and age in particular, that is extremely helpful. I mean, I'm sure everybody who's possibly listening, watching, or thinking about this has experienced medical care today, and it's sadly not great. And I think that there's a lot of good people in the system, but the system is not set up to encourage the best behavior. And the only way that's going to change is first with people insisting that this is the quality of care they want to provide. And second, with them using that influence and efforts to better the systems. But in the meantime, we just need people committed. I mean, you can't have people, not to get into the weeds, but I've seen patients who had surgery and they saw the doctor at a week out, and then they were told to make a 6-week appointment, but they can't get an appointment for 4 or 5 months. That's not acceptable. That's not even ethically acceptable. It's certainly not acceptable morally. And that's not, I don't think, where anybody who thought they wanted to be a doctor one day and aspired to that that's not the care I don't think anybody wanted to provide. But the systems are broken. So, we in plastic surgery, not to get on a high horse, because we are very, very lucky to be a little bit unleashed from the system.
Sure.
So, like that, to me, that comes with a responsibility. I can't blame the system for practicing in a poor manner or not following up and not being vigilant and all the things that we know everybody should do anyway. But there's no excuse, and we don't accept any excuse. And I think we present a practice model where you can still do that in an efficient system. It doesn't mean, I understand the limits on a doctor who, if you're primary care and what you're getting paid, and you can't spend more than 15 minutes with a patient, or you're now taking a loss, or you can't see enough people, and then you have to start this concierge care, and then you feel like you're limiting who you can see. But there's other ways to structure things. But what you can't compromise on is the core ethics and model of how you take care of a patient. When a friend or family member, your brother, sister, mom, we would want them, how do you want them taken care of, when you'd want them seen, how you'd want their question answered. There's all these portals. Every healthcare system has a portal. You put a question in the portal. They said they'll get back to you in 72 hours. If you had surgery, is that acceptable to hear in 72 hours the answer to your question? I don't care how trivial your question is. And by the way, most of them still don't answer you in 72 hours.
Right.
So, and I know there's probably a bunch of people nodding because they've had that experience. You put a question in, it's been a week, they said 72 hours. Even 72 hours is ridiculous. So you can't, there's certain things that can't be compromised on. I find it so sad that they are. And I think that we try to present a paradigm of practice. If somebody's setting up a practice or restructuring a practice, that they can, you got to have your North Star, you got to have your priorities, and then you build the structure around the core priorities. You don't just build the structure and then kind of let's not forget about this stuff. It should be built around them. That's the hull of the boat, so to speak.
I like that approach. So you've been in practice for 25 plus years.
Yeah.
What's the vision for your practice in the next 3 to 5 years?
Yeah. So I actually just read this book called The Way of Excellence by a guy named Stolberg. I can't remember his first name. Let me see. Brad Stolberg. And so I didn't want to act like this was my idea. But he said the key to satisfaction, excellence, what some people call arte, he said, is basically mastery and mattering. And I think that kind of catches it in really 2 quick words. I think there's a certain joy and flow, to come back to that again, in mastery of things that matter. And so, again, that doesn't mean we all have to be, working for the State Department to negotiate world peace. And it doesn't mean we have to be Mother Teresa dropping into battle zones of trauma and poverty. It just means we have to take care of each person, in our case, each patient, as best we can, the person in front of us, with everything we've got, both psychologically, emotionally, and physically, with regard to our tools and skills. And so that's how I define that. To me, that's my place in the system where I can contribute, is by taking care individually. And I think by doing that, you can kind of serve as a little bit of a role model or guide. And it doesn't matter if the person, I like to think, if you're a bank teller and you had a breast dog and you had a great experience, were really well cared for, you're going to then want to take care of your clients at the bank, a little bit better. And then those clients are going to, I think there's a virtuous cycle that gets started when people feel well cared for, well thought of, and well treated. And like we say in our, you stand taller, smile brighter, embrace the world with more confidence. And that enables other people to do it too. So that to me is the mattering part. Again, everybody decides that for themselves. So you ask where I'm going. I don't have any grand plans or aspirations other than I do like teaching a lot. I think that I went to a meeting in 1995 and I was just like in kind of like about 2 years before I finished my training in plastic surgery in 97, from general surgery to 95, plastic surgery 95, 97. And I went to this meeting in Florida and there was a surgeon from Miami and he got up on the podium and he wasn't one of these guys you see at every meeting all the time, everything the same. And he said, I've been in practice for 30 years. I'm retiring. And I thought I should talk one time about what I think. And that's kind of what my book is. My book is me trying to say, hey, look, I've been doing this. And I remember thinking, I want to be that guy. I don't want to be the guy who's been in practice 2 years telling everybody what to do and how to do it. Yeah. I want to be that guy that had been in practice 30 years. And I'm telling you what happened. He had his top 10. He was going through them. And, you've been to these meetings, and he used up he went through and I think he had 4 left. And they go, okay, time. And then the next speaker. And then after all those speakers in that session, they had a panel. And then people go up to ask questions of the panel. And the very first question of the panel was, can we hear his other 4?
Oh, I love that.
That people respected that he had been doing it for 30 years at a high level, and they wanted to know what he had to say and what. So to me, I avoided getting over involved in speaking and pontificating until, later in my career. If I'm going to get up on a podium, I'm going to get up because I feel like I have something to say. And if I'm going to teach, I teach the residents at UCSD and the fellows, and I do that. I enjoy that. I enjoy passing all that information. I have a son now who's in medical school, and it's fun to kind of, have that shop talk, right? Yeah, right. I don't know what he'll end up doing in particular. I want him to do whatever he loves because as somebody who loves what they do, I value that so much. I want that for him. I have a daughter in law school. I want her to do what she wants to do and a son in finance. So everybody has to do their thing. But so for me, it's a matter now of continuing to enjoy what I do, continuing to do it at a high level. That's the mastery, and doing it on behalf of patients and impacting their lives in a positive way. And then teaching. I do think it's really enjoyable then, you to pass these little things you learn on so they just don't go by the wayside. Mm-hmm. And some of them are very specific, how to, take your right hand, put it there. But a lot of them are a little more enigmatic and a little more esoteric. But those sometimes are the higher level things, how to approach things, how to handle difficulties. That's one of the things I learned in my fellowship with Bruce Cannell. I can't tell you how many problems he solved for me by discussing them, showing them, demonstrating how to deal with them in fellowship, so that they were how many problems I didn't have in practice, right, for the last 28 years now that I would have had it not been for his education. So just in honor of that, I felt the need to pass it on. And that's why this book was actually published on his birthday and in honor of kind of all that he gave to me and the other members of the Cannell Society. And now there's an endowment at University of California, Irvine that has an annual symposium to continue to teach his message and his methods. So it was really a book of obligation.
Yeah. Well, I think it's great because it does have the ability to help the patient, has the ability to help the physician, has the ability to pass on a great message in improving patients' lives, the butterfly effect or the golden rule. All of those take place from what you're doing. And you want to help people from the patient to the physician.
Exactly. Or as I like to say, what the platinum rule.
I don't.
So the golden rule is do unto others as you would have them do unto you.
Okay.
The platinum rule is do unto others as they would have done unto them. So
Ah,
that's even on the next level, like putting yourself in their shoes and what they want as opposed to just what you would want. And again, kind of getting in that patient hot seat, you
yeah,
know?
yeah. Interesting. I did not hear. Thank you for that. I'll make sure to re-listen and rewatch and hear that and start to implement that myself. So, if people want to learn more about your practice, please tell us where they can go. And also, if they want to learn about more about your book, where can they go to learn more about that?
So the practice is Miller Cosmetic Surgery, very creatively named, right? So, but it made sense at the time. So it's just Scott R. Miller, MD. I'm in La Jolla, but our website is millercosmeticsurgery.com.
Okay.
We're on Instagram. I don't know what the handle is and all
We'll,
that
we'll
stuff.
drop them all in the
You know,
description. People can get
but
them.
but that's our website, and that we really work hard to make that an accurate reflection of our practice, just to be consistent with who we are. So I do think it gives an accurate presentation of everything. I think there's some links and discussion to the book on there. The book's on Amazon. It's Authentic Beauty, like you said, defining a new care, a new standard, and so that's there's a couple other authentic beauty books. Some are novels, some are fantasy. So it's
Okay.
the one on medicine,
We'll make sure to get
but
yours. Yeah.
but um, but it's Scott R. Miller, MD, and that's it's really been it was a passion project, something I really wanted to do, something that was an interesting process because it involved some self-loathing and disappointment, and then finally got it together and felt like I had something of value to pass on. But it's been having it intact and giving it to patients and friends and having people find it useful. Had a patient, just of note, I had a patient who was diagnosed with a renal cancer and a kidney cancer, and she used some parts in it. We have a part that's specific for consultations that talks about your concern, the cause and correction, and how to go about that discussion with your physician. And she used that to help communicate and work with her doctors as she worked through that process. And she said she found that so helpful, and it gave her peace of mind and more information and more knowledge and helped her make decisions. So that was really rewarding, because that was really my goal, was to be about plastic surgery, but maybe to even give you some tools that transcend that and just move more to the general doctor-patient or provider-patient relationship.
Yeah. When you're out on the tennis court, sooner or later, more often than you are in practice, that book's going to be able to help people along the way. So that's a good thing, kind of leaving that passion project along the way. So last question for you, Dr. Miller. You've been a great guest here on the Prime Health podcast. I'd love to hear what your definition of Prime Health is.
So my definition of Prime Health, I think that would be able to be doing what you want to do with who you want to do it in the way you want to do it. And so that's what we all kind of seek out, is like, I think first you have to do a little soul searching and say, where do you want to be in 5, 10, 15 years? What do you want to be able to do? Who do you want to be able to do it with? And then more working backwards to make sure you're on track to achieve those landmarks.
Yeah.
If you want to be able to lift up your grandchildren who are 25 pounds now, then you better be able to lift up about 50 pounds. Or you want to be able to do that in 15 years, you better be able to lift up 50 now, right?
Yes.
So
right.
Things like that. I think that that's, you always need a why to stimulate any what. And so I think thinking through what your why, but that's my why, is to, I have kids that hopefully will have kids, and I want to spend time with them. I want to keep contributing to my patients. I want to keep providing for my family, and I want to be out and about. And, I always used to joke when I was a kid, I did not realize how lucky I was when I was a kid. When I was growing up in Las Vegas, hanging out at the hotel tennis courts at these different hotels, because that's where we all played. There were no country clubs or anything. We just played tennis at the hotels. And I knew very well that this was awesome. I would go after school. I'd get a ride to the hotel. I'd play tennis. I'd go home. I'd do my studying. I had some little jobs I did in the evenings, delivered pizza and the like, And so I thought it was awesome. And I always joked that I'm going to spend my whole life trying to get back to the lifestyle I had when I was 16. Yeah. And I kind of feel like that now. So that's my definition, would be, to be able to do the things that I want to do 10, 15 years from now with whom I want to do them in the way that I want to do them. Yeah. So, and that gives me the incentive now to sort of take care of myself.
Yeah. Well, I appreciate that approach to how you're going through practice in life. And I'm sure you instill a lot of that in your book with Authentic Beauty. And the important part about this, you've been a great guest. The story of you knowing what you wanted to do from the flow state, being a tennis player, you got a sweet spot on the racket. You know how all those things are kind of falling into place. You realize that you wanted to give back to your profession from the mentors that were there and help to become better. You end up writing this book to help that along the way. And what I think people need to understand is you could hear his passion when he speaks about his practice, about his book, and really about his patients. So if you're out there, whether you're a physician, plastic or cosmetic surgeon, or a surgeon in regards, or if you're a patient, if what you heard Dr. Miller say could benefit at least one person, we know it can benefit more, but please do share this with that one person, or share it with as many people as you can, because the message needs to get out. He speaks value consistently about the golden rule, which I brought up, and the platinum rule, which I love. So that's fantastic for that. And it's always good that the listeners understand there's a reason behind this podcast. Take it for what you like it, but share it with somebody else. And I think that's so important. I always do say selfishly, we love if people subscribe to the podcast, for that. And then because it helps both of us grow in our businesses, and Dr. Miller would love to get some more book sales, I'm sure, and we'll help him with that. But until next time, remember that everybody is on a journey together towards true wellness. Or whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So we do always ask, please do stay committed to your Prime Health journey. And again, Dr. Miller, thank you very much for being a great guest on the Prime Health Podcast.
Thank you. Enjoyed it very much.